Hey guys, how are you doing today? So let's see what we have for today. So basically, guys, I think we don't cover heart disease as a topic, complication of MI, which was another topic, and then also we almost cover valvular heart disease. Now, guys, for this simple video, I hope I can finish it within 10 minutes. So basically, what I usually advise is you study mitral regurg as a page, mitral stenosis as a page, aortic regurg as a page, aortic stenosis as a page, prolapse, hypertrophic cardiomyopathy. So you have six. Now you have to make sure that you study all of that in a differential diagnosed way, and to make it in just a few lines or or just one page. This is really important, because the problem is when you see the case, you will see the options basically talking about mitral regurg, mitral stenosis, aortic regurg, so they will put everything together. That's why really I advise you to follow these steps. Now, how we will do it, this is, oh my god, why it is thick, sorry. How we will do it, basically what we have is, the first things you have aortic regurg here, and let's say you have mitral regurg, then you have aortic stenosis, and finally have mitral stenosis. So the first thing, guys, you have to know, and I think we talked about that, guys, all of them share in one thing, which is usually shortness of breath plus murmur. So you are talking about shortness of plus murmur. The only one, now this is the clinical feature. Shortness of breath plus murmur, usually are talking about these four. Don't forget, stall prolapse and hypertrophic cardiomyopathy is a topic, but I cannot put it here because of the page. Second, because we talked about those both when we talk about mechanisms or maneuvers. Now, shortness of breath and murmur, this is a clinical picture, the major things. Now, how about the aortic stenosis? Is there anything? Yeah, you have a triad here, so you can make the triad. And the triad usually talked about syncope number 1, if you remember, chest pain number 2, right, and shortness of breath. So that's interesting in aortic stenosis. And when we talk about shortness of breath, that's when he's talking about heart failure, and is usually chronic cause. I will go with the chronic, guys, because the chronic is the most important one. Anything specific for aortic regurg? Yeah, big time. A blood pressure you will see in aortic regurg 180/60. Please. I cannot tell you how much this is really big time. High yield. High pulse pressure, usually your answer is aortic regurg. Could be an anemia, by the way, but usually your answer is aortic regurg. Mitral regurg, any specific features? Not really. Mitral stenosis, any specific features? Not really too. So we're done with the features. So I did the features basically, or done with the clinical features, or maybe it's not history. It's just physical exam. So we're done with the physical exam to differentiate for. All of them, guys, again, all of them share in shortness of breath plus murmur. So again, when he's talking about shortness of breath plus murmur, that means he's talking about valvular heart disease. Now, how about the causes? Let's make more fun. Let's talk about the let's talk about the chronic as a causes. All right, and then we'll talk about a little bit about the acute. Now, for aortic regurg, aortic stenosis, guess what? What is the most common cause of aortic stenosis or regurg? However, it depends on the age, but I would really like to put bicuspid here. I know, maybe it's weird. You put bicuspid as a cause for aortic regurg, right? And you put bicuspid also as a cause for aortic stenosis, but you know what age? Let's say the age usually 50 to 60 years. So 50 to 60-year-old, that's been, and with aortic stenosis, go with bicuspid aortic valve. Now, if you'll put 70-year, so go with another cause, which is another, sorry, I don't want to mix it with, yeah, that's important. It's not bicuspid usually. If you'll put 70-year, okay, let's make it more fun. Let's make calcium here, which is calcification. Right? Calcification is usually a cause, which is the most common cause of aortic stenosis, but I usually will put 70 years. All right? So this is a cause. So you get bicuspid for both. Please, you get bicuspid for both as a chronic. Again, I'm not talking about acute here. For both, but for 70-year aortic stenosis, you can put calcification. So about mitral regurg, mitral stenosis, please, it's very easy. Rheumatic fever. And I think also you remember that 10 years or 20 years after rheumatic fevers, you put regurg, while 20 years or 30 years after rheumatic fevers, you put the stenosis. That's really interesting, really fun, really easy to remember them. So again, For aorta problem, go with the bicuspid valve as a problem. For mitral problem, go with rheumatic fever as a problem. Then each one of them have some differential diagnosis regarding the age or the durations. So far, any question? Is it too hard? So far, you get clinical examinations for all of them. You get the most important cause for chronic one. Okay, again, these are the chronic. Now, how about the acute? Do I need to talk about the acute? I think it's why not? I mean, why not? So let's say, do I need to talk about the acute of which one? For regurg. So I will put acute for regurg as a mitral regurg acute or aortic regurg acute. I know it's really interesting. For mitral regurg acute, look what I'll put. I'll put endocarditis. Right? The same endocarditis, put it here. Although I feel I can maybe make it in another way. It's much, yeah, because I usually don't like to repeat the same word, but this is what comes to my mind. So acute endocarditis, mitral regurg. What next, which is the most important, the thing that we talked about, papillary muscle dysfunctions. All right, or rupture, which is basically I'm talking about MI. So that's it, guys. So we're done with the acute, we're done with the chronic. Let's make the chronic one, which is basically in the green. Let's make it green chronic to make it more sense, and makes this also chronic. Features, the same, shortness of breath plus murmur. However, shortness of breath just within a few hours, that's when he's talking about acute. Shortness of breath, if it's talk about months, that's when he's talking about chronic. Now, I really would like to talk about, oh, I forget something. Wait. I forget something very high yield for mitral stenosis. Anyone remember one specific features for mitral stenosis in the physical exam? Pulse. Yeah, I just now remember two things. Pulse, please. Irregularity. That's mean it's talking about atrial fibrillation. Very high yield mitral stenosis. Why? Because the atrial, so big, not working so good. Atrial fibrillations. About aortic stenosis, delay carotid. It's also features for severity, by the way. Delay carotid upstroke. It's also interesting. So we done, sorry, I think now it's much, yeah, now it's much better. Trying to remember mitral regurg any specific other than SS3, and I don't think SS3 really a big deal here. SS3 usually the answer for heart failure. Yeah, I'm not sure if I put SS3 here. I don't want to confuse you guys. Excuse me. So pulse, irregular atrial fibrillations, please don't forget that. So we're done with the physical exam. We're done with the causes, whether it's acute or chronic. And these are details, by the way. Don't think I skip stuff. Now, what else I need to, what else, guys, you need to know? What else? We're done with the causes, we're done physical exam. Maybe systole or diastole and the murmur, which is big time. Aortic regurg. Let's see how we will make it. For the aortic regurg and the mitral stenosis, I'll put it like this. For both of them is diastole. So you get mitral stenosis as a cause is diastole, and you get aortic regurg, not a cause, sorry. You get aortic regurg as a feature is diastole. Which one is early, which one is late? From the arrow. The beginning of the arrow, let's make the arrow, yeah, let's make it, yeah, okay. Let's start here. So this is my start. So basically here you get early diastolic murmur, and for mitral stenosis, let's get this up. And for mitral stenosis you get late diastolic murmur. Really? I mean, really, that's interesting. So you get because that's hard for you, that's hard. Sometimes maybe you have to say, hey, regurg usually systolic, stenosis usual diastole. It's not always the case. And we talked about that when we talked about pathophysiology. You can just go back. So for aortic regurg and stenosis, how I put it? I put the diastolic for both of them. Early diastolic is, you can say early diastolic is aortic regurg. So basically here early diastole, we'll write it again, and you have late diastole. Nice, very nice. I don't want to make a cross because I think I will mess up the page. So how about the others? Makes sense. The others is systole, guys. Makes sense. You have only two diastole as a murmur, by the way. Two diastole usually as a murmur, which is big time. aortic regurg, and mitral stenosis. So the others, just to flip the coin, will be just systole. So here you get systole and pansystolic, and here also you get systole and usually ejection, which is crescendo decrescendo. So we're done with the murmur. How easy is that? So look, this page, it's not a big page. It's just a few lines. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 lines, you finished valvular heart disease. I didn't talk about valvular by the way here. Yeah, but I talked about really details pathology. We cover the causes, we cover most important clinical features, we cover maybe most important history also, which is basically as a kind of causes. So, and we cover the murmur, and we cover some specific blood pressure, regular, like this. Now, how about treatment? For regurg, guys, yeah, I don't know where I put it, but always for regurg is afterload reductions as a treatment. So I'll make here note. All right. Regurg treatment is always, you need a medicine. It's option, by the way. It's just a measure. I mean, just to decrease the symptoms, you need after load reductions, usually ACE or sodium nitrophosphamide. I'm not sure, but usually after load reduction is really important for both regurg. And we talked about mitral regurg, if you remember, in the mitral regurg lecture. So after load reduction for regurg. For the stenosis, hey, there is no way for any medicines. It just goes surgery. All right, which is basically repair or valvuloplasty in case of mitral stenosis. So I think that's really interesting for you. Interesting how to overview what the valvular heart disease in this case. Now I still believe that there is another. It has to be there is another lectures or mini lectures for physiology, but because we didn't really go deep with the physiology for each one of them, so maybe when we go to cardiophysiology, sure, we'll cover that. But this is pathology, kind of pathophys with the causes. Guys, this is the way how you'll make it. Please don't study page by page. Again, I always talk about that. You can't study page by page just in the beginning, but then after each topic, you have to make just a few few lines inside your mind that you have to study 4 or 5 or 6 diseases together, because again the options will be A, B, C, D, E, F, G, whatever. Each A is mitral regurg, B mitral stenosis. So there is no way to get it right without going over all of them within just one slide. All right, hopefully this is helpful, and we'll see you soon in the next topic. Maybe the next one will go with rheumatic endocarditis. Still I have rheumatic endocarditis. Still I have cardiomyopathy or heart failure. So maybe just 2 or 3, and hopefully we can go later with renal. All right, guys. See you soon.